So the first person is Yukiko Tsunematsu from Tokyo.
Thank you, Dr. Evans. It is an honor for me to be here. I'd like to talk about recent Japanese Li-Fraumeni database. Recently, the Japanese Li-Fraumeni syndrome expert group was established. The purpose of this group is to facilitate the recognition of various problems with Li-Fraumeni syndrome in Japan. This slide shows the role of each member. I am the oldest, therefore appointed to the head of this group. In Japan, due to the so-called Angelina Jolie effect, the interest in genetic testing of HBOC is increasing, and the demand for testing of P53 in patients with breast cancer families not having BRCA1/2 mutations has increased. The TP53 database, IARC of new version 2016 was launched this April. This slide shows the objective of this study. Subjects were from families previously enrolled in our Li-Fraumeni family registry. New families have added via self or physician referral. Most of our data were mainly derived from a review of the literature. This time, we sorted also distribution of tumor types and codon frequency in Asian country from IARC recent database. The analysis were limited to 56 families with an identified pathogenic or likely pathogenic pedigree families. A total of 215 tumors were identified from the family history. Among 215 tumors, 127 were identified to have occurred in 73 individuals who were confirmed to be mutation carriers. Of the 73 carriers, 32 had multiple cancers. If we break down by site, showing below, breast cancer, 19, 4 thyroid cancer included. And lung cancer and colon cancer, stomach cancer is frequency is was very high. And in liver cancer, 2 differentiated sarcoma, 14 and 11 years old each. We found that in the literature, the undifferentiated embryonal sarcoma, the pathological report, in this report, originally found that 24 Li-Fraumeni kindred was included. This lady had sarcoma in the liver, and now suffering from breast cancer and thyroid cancer simultaneously. This is this graph shows also high incidence frequency of stomach and lung and colon cancer. I read Dr. Afrin's paper with great interest. Based on IARC 2012 database, Dr. Afrin pointed out a frequent occurrence of gastric cancer in Asian kindred and different mutation frequency between East Asian, North American, and Western European. Recently, I sorted out Asian families and affected individuals who were confirmed to have TP53 germline mutation from IRA new database. If I excluded Japanese families, there are only 2 persons who had stomach cancer. I made 3 graphs of colon distribution comparing IARC, Japan, and Asian countries, excluding Japan. There are larger differences between Japan and other Asian countries than between IARC and Japan. Japan does not share similar result with other Asian countries. The type of mutation in the present study is similar to the IARC database. This is age-adjusted mortality rate of breast cancer in Japan, showing an yearly increase. I will show you trend of in age-adjusted mortality rate comparing the United States. Stomach cancer is now decreasing, and lung cancer is still high, and surprisingly, colon cancer is now overtaking the United States. In summary, US-Japan meeting, in summary, gastric cancer and lung cancer in young patients and thyroid tumor may be considered new additional component to be devised template criteria, especially to Japanese families. Thank you.
Thank you very much. Time for one question. John.
Thank you. As you know, in Japan and East Asia in general, central nervous system germ cell tumors are far more prevalent than they are in the rest of the world. So I wonder if any of the cases of brain tumors that you have identified, other than the 4 choroid plexus tumors, were actually primary CNS germ cell tumors.
Oh yes, We didn't have any germ cell tumor in the central nervous system. For CPC and other astrocytoma.
Thank you.
Thank you very much. Thank you.
Thank you.